July 2018 marks the 1-year anniversary of the end of the Mosul battle. In just the month of May alone, 46,000 people returned to a city that is still partially in ruins. One of the big things affecting the local population in Mosul at the moment is that 70% of the health system, the health infrastructure, is still dysfunctional, partially because the people are still displaced, the medical professionals are still displaced, and partially because whole medical complexes have been leveled and have been fully destroyed. The improvements that are being made in the reconstruction of Mosul are very slow, and in the health sector in particular. The needs in terms of primary healthcare, secondary healthcare, and more specialized services continues to be huge, and there is a growing gap between the available service and the needs of a returning population. Healthcare in Mosul is affected by a number of shortages. A lot of medical professionals are still displaced, equipment is lacking, supplies of medications are lacking. At the moment, there are only 5 hospital beds available for every 10,000 people, which is about half of what is internationally accepted as a minimum standard. In spite of the large number of people returning, Mosul is actually still a very dangerous place to live. The west part of the city especially was affected by the heaviest fighting, and the destruction is almost unbelievable. It affects every aspect of people's daily life. Water, electricity and other basic services are barely available. Hygiene standards are very low, and it only increases the need for adequate healthcare to be present also in that part of the city. Even though the war is technically over, the aftermath continues to generate victims. If we look at the emergency room of MSF's hospital in West Mosul, about 95% of all the trauma cases that we receive these days are related to unsafe living conditions. People falling off of buildings, structures collapsing on them, and other accidents relating to the level of destruction in that part of the city. Much more needs to be done by both the national authorities and the international community to reconstruct, rebuild Mosul city and ensure access to medication, quality healthcare, equipment and supplies for the people returning to Mosul city.